Well, this is the main focus of our discussion this evening in terms of HIV. Dr. Samuel Kinyanjui, the Country Director, AIDS Health Foundation, is joining me in studio. And Professor Richard Muga, who's the Head of Health Services in Homa Bay, is joining us on Skype. Homa Bay is actually one of the most affected counties with the highest number of HIV infection rate. Prof, as the Head of Health Services in Homa Bay County right now, which has the largest burden in terms of HIV, how are your stocks as we speak?
Thank you very much, Trevor, for having me this evening. And I want to say that Homa Bay carries one of the highest burdens of HIV/AIDS. And as we talk now, our stocks have gone down. You find we have started rationing drugs to patients. And if this continues, then soon they will have no drugs.
But Prof, Prof, you engaged in the strengthening of the current integrated systems of supply chain in Kenya. What is the way forward in terms of resolving this stalemate that we're seeing between USAID and Kenya government?
Well, I chaired a task force in 2008 to restructure KEMSA. Yes. And during that time, together with partners, we agreed that we will have a pool system, and KEMSA will be the one to distribute drugs, all the drugs, partner drugs and drugs bought by the government will be distributed by KEMSA. And this has worked on very well, because name any health facility in Kenya, you will find that KEMSA is able to take drugs there in time and receive the orders that are needed. And so for me, I would suggest that United States, a very strong partner for us over the years, they need to review their stand, and they need to continue to allow KEMSA to distribute the drugs, you know, life-sustaining drugs like ARVs.
Yeah. Otherwise,
many people are going to suffer, and all the good work that we have done together with the US government will go to waste.
Okay. Prof, stay with me. I'll come to you in just a bit. But Sam, what is the risk of delayed distribution of medication to persons living with HIV and AIDS? Sam?
Thank you so very much. You've called me an unusual name. So thank you very much. The greatest challenge with the delays in the distribution is that the patients are going to miss their medication. And the greatest danger we face are twofold. Number one, is that immediately the patients miss out on their treatment, we may start seeing they are raising viral load, and when the viral load are raising, the disease is becoming complicated, and we may start increasing number of people getting severe HIV, what we call advanced disease. There may be increased morbidity, and we can have some people die. In the long run, we'll be looking at what we call HIV drug resistance. This is a major situation that we do not want to get into.
What do you mean when you say HIV drug resistance? Is there categories to this?
First is that for HIV, our first line is our best line of fight for HIV. The key is to attack the HIV virus in the body of any individual with the best medication we have. And now we have the TLD. To lower the virus so that it's not even detectable, to less than 50 copies per drop of blood. If you maintain it at that low level, it is unlikely that the virus will mutate and change and become resistant to the treatment. Because it becomes resistant to the treatment, the current treatment we are getting is on average of about 600 Kenya shillings per month per individual. If it becomes resistant, it will force us to go to the second line of treatment, which is more expensive. It is about 2,200 to 2,400. That is almost 4 times the current dose. And that kind of drug is more expensive, more difficult to come by, has more side effect. If they fail on that one, then we have to go to the third line of treatment. The third line of treatment is more expensive, retailing at about 6,000 to 7,000 per month. Unfortunately, the third line is not even publicly available. It has to be imported on need basis. It will take time and is expensive. To be qualified to get to the third line, you need to undergo drug sensitivity testing, which will cost you about 8,000 to 10,000. Many people cannot afford that.
Okay.
Yes.
So Samuel, what would be the lasting solution to this standoff?
I am impressed that the Kenya government has decided to start a fund to make sure that most of the drugs that are used by Kenyans are bought with the Kenyan money.
Yeah.
I call it the Kenyan money because the government does an aggregate of our taxes. Finally, it's still Kenyan citizens' money. And I would consider this good use of Kenyan money.
Okay.
I think if 80% of our drugs come from the taxpayers' money, then we will have some stability.
All right. Thank
you very much.
All right. That's Dr. Samuel Kinyanjui, Country Director, AIDS Health Foundation, speaking to us, and Professor Richard Muga, Head of Health Services in Homa Bay, speaking to us via Skype. Thank you so much for that context. We'll keep